Hi guys, so in this video I'm going to talk about why I think Mama Dr. Jones shouldn't be used as additional content in sex education in Arizona. Now, just to contextualise the issue, Mama Dr. Jones is an OBGYN and gynecologist who does OBGYN and gynecology content on YouTube. Now, her videos were actually being used as additional content within among certain teachers within Arizona. And the school board in Arizona was very concerned about this and decided that Mama Dr. Jones's content shouldn't be used. Now, I have very similar concerns to the Arizona school board on her content. I have watched quite a lot of her content, mainly because I'm kind of interested in learning more about the kind of medical reasons as to why to not use contraception, basically. And I think that she gives some very good medical advice on that kind of subject. However, her videos are also very political, and she is very pro trans rights. She's very pro Black Lives Matter, and she doesn't really understand the reasons as to why people would be against abortion in a lot of circumstances. So, for example, she doesn't understand why people would be pro-life from conception. And so these are major issues that I have with her videos, that they're very political. So my main issue is her content is being taught to 11+-year-olds. And I have no issue with 11+-year-olds being taught about periods or being taught about reproduction or sex. I don't have an issue with that. However, I do have an issue with 11+-year-olds being taught about abortion in what is a very pro-life manner. I have an issue with 11-year-olds being taught about Black Lives Matter, which is in a very pro-Black Lives Matter stance, and I have an issue with them being taught about trans issues in a very pro-trans stance. And the main reason for this is that at the age of 11, you don't really understand that adults are wrong about political and social issues, and that you may have a different opinion to someone else on a political and social issue. You just kind of you just believe whatever people in charge are saying to you, and that's my main issue with this. My main issue is that they just don't know enough to respond, and they aren't really old enough to formulate their own opinions on these issues yet. I also have an issue with her content being taught in isolation from 13 plus. So at the age of 13 plus, I think it's fine to discuss things like contraception and discuss things like abortion, but these are much more controversial issues, and there are people that are very against contraception. There are people who are very against abortion, like myself. And there are other people that think those issues are perfectly fine. And so having her content taught in isolation to, 13+-year-olds, and she's saying that, contraception is fine, and that, she doesn't really understand why people would have an ethical issue against the morning after pill. That's wrong to me, because what we should be doing from the age of around 13 plus is giving, those teenagers all of the information possible about all of these issues and about all sides of the argument, and letting them come up with their own conclusions about what they think is right and wrong. That's what we should be doing, rather than just giving them a one-sided view on, trans rights are great, and the BLM is great, and I don't know, contraception is great, and abortion is great, that kind of thing. I don't agree with that stance, and I think that it shouldn't be taught in isolation. I have no issue with her videos, for example, her video on the abortion ban in Texas, them watching her video and then watching a video that's pro the abortion ban in Texas. and then, you know, them coming up with their own conclusions about it. I have no issue with that. But what I do have an issue with is when her content is taught in isolation and it makes children just think that she's absolutely right on these subjects when she's not absolutely right on these subjects. These are very nuanced kind of political issues. Okay, so I'm going to respond to a few clips from her channel just so you understand what's wrong with her channel and so that you get her within context as well.
Because you should be able to make the most informed decision for yourself. And that is, okay, I don't believe life begins at conception. I believe life begins sometime after that. So I'm fine with plan B. I believe that life begins at conception, so I'm not fine with plan B. However, again, there's not really very good evidence that it's very likely to interfere with implantation anyway. Not to mention the fact that this doesn't even take into account the fact that when you are not on any form of contraception, you're having sex with someone who can get you pregnant, the chances of a fertilized embryo being there and not implanting is higher than if you take something that primarily works by preventing ovulation, meaning you're more likely to have a fertilized embryo that doesn't implant when you're on no form of contraception than you are to have one that doesn't implant when you take plan B, because it's primarily working by preventing the ovulation and fertilization altogether. So even if that's a secondary effect, the result is still less lost embryos that are fertilized if that's something that's important to you. So these are all nuanced things, and that's why I hate when people present it as like facts like that. But
okay, so as Mama Dr. Jones stated in her video, whether hormonal contraception, including emergency contraception, prevents the implantation of embryos into the uterus is a very contested issue. We don't know either way, and scientists don't know either way, and that's okay. However, personally, I wouldn't choose to use a form of contraception that might kill someone. And what she doesn't really understand in this video or on this clip is the difference between intending to kill someone and not intending to kill someone. Now, if I decided to take emergency contraception, then I would be performing an action that I knew might harm someone in some way. If I was, for example, trying for a baby and the embryo happened to not implant in the uterus, I've done nothing in any way to prevent that natural process from happening. And so it's not about, you know, whether the number of embryos that implant into the uterus. It's about my intention. I mean, I'm not going to blame a woman for having a miscarriage, despite the fact that she knew that might happen if she had a child. But I would be against a woman having an abortion. There are some things that just happen which are very sad, and there are other things that people actually do with an intention of doing them, like having an abortion or using hormonal contraception, which actually prevent life from taking place.
So some of you may have noticed that occasionally on this channel, I will work to include gender-neutral terminology. And the reason is because it's really important that we include everyone in our broad discussions of healthcare.
Okay, so there are two main issues with her using gender-neutral terminology. The first issue that I have is that using gender-neutral terminology might not always be accurate. And the second issue that I have is the fact that when you start to use gender-neutral terminology, I have the concern that it allows for the invasion of men into women's spaces, basically. So in terms of it being scientifically accurate, for example, if I said the statement, people who have periods should have periods around every 28 days. It might be longer or shorter depending on the person. Now, this is essentially scientifically inaccurate for a lot of trans men. So if you're a trans man and you're on testosterone, you might still have your periods, but they'll be very, very irregular. And so it's scientifically inaccurate for that group of people. And this is one of the issues. The issue is that the type of medical care and sexual health advice that you need if you are a trans woman or a trans man is going to be completely different if you're a biological woman or a biological man, because you may have had surgery down there, you may have, be on hormone blockers or testosterone, which are mucking up and messing up with your hormones. So they're essentially changing your body to make you something that isn't either a man or a woman. So this inclusivity of trans men and trans women in female health, it comes with a number of scientific inaccuracies. So apart from this language being scientifically inaccurate, my other issue is the fact that when we start saying things like with people with vaginas, people who have periods, it starts to allow the invasion of trans women into female spaces. And the main issue that I have with this is that I'm concerned about the women in those female spaces. I'm concerned that the women in those female spaces will lose their gender-specific areas, especially when they're very vulnerable and especially when they're in hospital. Trans women, even trans women who have had the full operation, are more likely to rape a woman than a woman is to rape a man. And the reason for this is that they're still psychologically male. And for men, sex crimes are very, very common, but for women, they're very, very rare. And women who do commit sexual crimes tend to be with a man, and it tends to be that they're doing it as a kind of couple thing. With men, they're much more likely to rape women, and it's a very, very common crime within the male population. And so having trans women with vulnerable women, especially if they're in hospital, is going to be a disaster. And I'm worried that if we start saying people with vaginas, then we're erasing what it is to be a biological woman, and we're allowing for the invasion of trans men into female spaces. And so that's my second concern about that. Anyway, thank you for watching the video, and feel free to like and subscribe if you like it, and comment down below. Okay, well, thanks for listening. Bye guys.